end-stage renal failure. A 68-year-old female presents to the clinic with current complaints that she is lacking energy, she feels weak, and she has decreased endurance. She wants to remain living independently in her home. The client is currently suffering from end-stage renal failure, where she requires 3 dialysis treatments per week. The renal failure was likely caused by the stress that was placed on her organs over the past 15 years living with non-insulin dependent diabetes. This client also suffers from peripheral diabetic neuropathy and has had foot ulcers in the past. Diabetic neuropathy is caused when diabetes is poorly managed, which damages the nerves, which affects the ability for the patient to feel sensation in their feet and hands, causing ulcers, dry skin, reduced sweating, and decreased balance, which are all factors this client is suffering from. The client has also recently had a fall, therefore is apprehensive about climbing stairs, walking, and completing physical activity. The client is currently taking erythropoietin and iron supplementation to help with their fatigue and anemia that is associated with end-stage renal failure and dialysis treatment. The client is also taking metformin to help control their blood sugar levels and paroxetine, which is used to treat depression, meaning this client is likely suffering from depression. This is a common occurrence with patients suffering from end-stage renal failure due to their quality of life dropping significantly in this population. The client will require home visits and in-dialysis exercise program. They only have a Swiss ball and a TheraBand available to them at home. The benefits of exercise this client is likely to see include increased ADL ability, increased energy, decreased weakness, increased endurance, heart rate variability, decreased falls risk, and better blood lipid and blood sugar control. These are the goals of the program. So in order to achieve the client's goals of increasing energy, the practitioner would have to increase the mood state and educate the client on their condition and how exercise can assist their condition. This can be measured through the kidney disease questionnaire. The score on this questionnaire could be expected to improve within the first 3 months, but should improve all the way through. In order to achieve the client's goals of increasing endurance, the practitioner would need to increase muscular endurance and increase the balance ability and walking confidence of the client. This would be measured through an increase in the 6-minute walk distance. The result in the 6-minute walk test would be expected to improve by 30 to 50 meters in between the 3 to 6 month period of time. In order to achieve the client's goals of decreasing weakness in order to live unassisted, the practitioner would have to increase physical activity, increase strength, and educate the client on how to safely exercise. This could be measured through the grip strength ability of the client and the timed up and go result. The timed up and go result could be expected to improve within the first 3 months, and the grip strength result could be expected to improve between the 3 to 6 month period of time by 14.5%. In order to achieve the client's goals of decreasing their fear of falling, the practitioner would have to increase the lower limb strength and increase dynamic balance. This would be measured through the short physical performance battery result. This would be expected to improve within 12 months. These are the client's testing results, which have come back mostly normal, apart from the fasting glucose levels and the 6-minute walk test. This would indicate that the client needs to further work on their glucose control and work on their fitness and falls risk to help increase the distance they walk in the 6-minute walk test. The client's total cholesterol is also borderline, therefore it would also be beneficial to look at decreasing these levels. These are the further tests that should be conducted on this client. The first is the short performance battery. because it is a good measure of lower body movement, and it also is a good measure for falls risk and mortality rate. Therefore, it is an important measure to include. The second test is the grip strength test. This would be a good gauge of limb asymmetries due to the client only being able to use one of their limbs half the time due to their graft getting in the way. It is also a test that has a low energy cost and would be good to track whole body strength throughout the program. The third test is a timed up and go test. This is a good measure for ADL ability, and it has also been linked to falls risk, which is another important measure for this client. The fourth test that should be included is the kidney disease questionnaire, as it has been shown to be useful in this population, and it is sensitive to depressive mood, which should be useful to track in this client. The last test that should be conducted on this client is the foot myofilament testing, as it would be a useful way to track the progression of their neuropathy. During testing, blood pressure and sugar should be taken regularly. RPE should be monitored, as well as heart rate, as the client's medication and condition will affect their heart rate response to exercise, and regular breaks should be taken to ensure the client's safety throughout the session. These are the factors that have to be considered when dealing with this client for their safety. Their blood pressure and blood sugar should be taken regularly, and they should be given regular breaks. The use of the right arm should be minimized as much as possible during dialysis treatment, and RPE should be used due to the effect that the client's condition and medication has on heart rate and heart rate variability. Paroxetine also affects the client's VO2 max capacity, therefore meaning the client will have a lower exercise capacity. The goals for the dialysis program are to increase physical activity, ADL ability and strength, and decrease temperature changes during dialysis. The considerations are the same as the last slide, with addition to the fact that exercise should be completed in the first 2 hours of dialysis at an RPE of 11 to 13 for aerobic exercise and 12 to 15 for resistance exercise, and the client should be reminded to avoid holding their breath during exercise. One dialysis program. It has been designed to incorporate both aerobic and resistance training on the same day in order to meet the recommendations for both end-stage renal failure and diabetes. The warm-up is a light cycle on the cycle ergo for 10 minutes at an RPE of 11. The client will then move to the resistance part of the program. The resistance part of the program has been designed to work all the big muscle groups. The muscle groups have been split into mostly upper followed by lower to give the client adequate rest. If there is a body part repeated 2 times in a row, the client will be given more rest to mitigate fatigue. The client will initially start with 1 set of 12 reps at a tempo of 4-2-2 with a 1 to 2 minute rest, slowly increasing the RPE through increasing reps, sets, tempos, and then progressing the exercise to the progression exercise. This should happen by 5% each week. This is in line with the current evidence and the guidelines for people with end-stage renal failure and diabetes. It is important to note that progression for this client won't be linear. There will likely be weeks where fatigue will be an issue, therefore the practitioner will likely have to cut exercises and regress exercises based on the client's presentation. Dorsiflexion and plantarflexion exercises have been included to assist with the client's walking ability and falls risk, as foot clearance is an important increases to mitigate falls, and this can be achieved by strengthening the plantar flexors and dorsiflexors. Hip flexor strength exercises have also been included for the same reason, as this increases foot clearance on stairs and whilst walking. The final part of the session is a 10-minute cycle on an ergo at an RPE of 11 to 12. This is to increase cardiovascular fitness and aerobic capacity. Home program goals are to increase balance, strength, and ADL ability whilst also increasing physical activity levels. This program should be completed on non-dialysis days. As part of this program, the client should attempt to complete a 10-minute walk with other people around. This can be increased by 5 minutes each week. progressing to 2 to 3 bouts eventually. This client could also consider taking part in yoga and tai chi, as they have been shown to be useful for balance and falls risk, as well as good for socialization and mental health. The programming rules and special considerations are the same in the home program as in the dialysis program, with addition to minimizing position changes during the home exercise program to minimize changes in blood pressure. So exercises move from standing to seated to ground exercises. The home program has a big balance component to increase the client's confidence and ability to walk and navigate stairs without falling. The marching on the Swiss ball is designed to challenge the client's balance whilst they are in a seated, weight-supported environment. Then it is progressed to a tandem walk to increase the balance demand faced by the clients. The calf raises were included to strengthen the muscles needed to walk and climb stairs, as well as have adequate foot clearance to minimize falls risk in this client. The upper body movements in this program have been prescribed bilaterally initially to promote the use of both sides due to the fact that only one arm is being used during the dialysis program. Doing these exercises bilaterally allows for one side to take some of the slack if needed. The client is told to stop doing exercises if they feel pain at the graft site. Evidence suggests that it is okay to use the graft arm when the client isn't on dialysis. The upper body exercises then progress further to use the arms unilaterally to strengthen the graft arm without the help of the other arm. As with the dialysis program, progressions won't be linear, and exercises will have to be progressed and regressed at different times depending on how the client is feeling. Whilst completing the program, the client experiences blood pressure changes that cause dizziness and heart palpitations. In order to mitigate this, the practitioner educates the client that the blood pressure changes are normal during dialysis. However, the practitioner ensures they minimize any position changes that occur during the session and make sure they take blood pressure every 15 minutes or when symptomatic. Longer breaks are also given to the client to help minimize this. The EP monitors for chest pain and stops exercise if heart palpitations or chest pain arise. The EP also refers the client back to the doctor to look into the heart palpitations and see if there's any medication needed to treat this condition. The client has also bumped their graft arm during one of the home programs. To mitigate this, the bilateral work has been avoided for 2 weeks post this injury happening. The client has been educated that they need to be mindful when using their arm during the exercise program and throughout the day. The client would also like the EP to attend the dialysis treatment 3 times a week instead of just once a week. In order for the client not to be overloaded, the home program will have to be dropped to once a week, and they will complete 2 resistance sessions during dialysis program and 1 aerobic session. This is the progressed dialysis program for the client. As they are now completing this program 2 times a week, the sets and reps have been kept the same as the initial session. However, they are now completing this 2 times a week. The reason the reps and sets weren't increased as well is because this population can only increase their load by 5% a week. The client will also be completing a cycling session where they complete 3 times 10-minute intervals at a RPE of 12 to 13 with 3 to 5 minutes rest in between the intervals and a 5-minute cool down to lower the BP, the heart rate, and the risk of heart palpitations. The home session in week 6 will only use the left arm for upper body exercises due to the pain in the right arm at the graft site. The balance exercises have been progressed to the tandem walk, as after 6 weeks of the program the client should be feeling a little more confident walking. The client is now completing 2 sets of exercises at a tempo of 2-2-2 instead of 1 set at 4-2-2. This is in line with the progression guidelines for people with end-stage renal failure.